and super, super excited for this today. We are going to be doing something I've actually never led before. And so we're all going to be in this together, where we're going to do a brainstorming virtually on Mural Board about a question that was posed by, the Icon Summit team. It's a very important question, especially during this time of COVID. How to make telemedicine and electronic health and wellness support available to the underserved and at-risk communities who don't have internet or technology access. This is a really important question in general when you're not in a pandemic, and we're going to look at some of the facts and the challenges that I pulled as to why, but especially during the pandemic. And maybe, the silver lining here is that we're finally really starting to talk about this problem, because it's a problem for a lot of people, but it's always been a problem for some people. And so I'm really excited today. Definitely unmute yourself, chime in, like we are all going to be brainstorming together. We are a team today. And so I'm busy looking at my mural board. So I'm not worried about if you're in your PJs, if you're laying in bed, starting this conference today, no worries. We are going to have a really, really awesome conversation about this that I hope end in some action items and some exchanged emails, and maybe something real is going to come out of this. That would be awesome. And so here I just pulled some facts just to get our brains moving a little bit here, and let me show you the overview of what we're going to do. So we have some statistics I want to go through, some challenges for us to keep in mind, some data. I'm a scientist, geneticist. I love graphs. I love data. So we're going to look at a little bit of graphs. And then I want to lead us through some questions. Who are these patients? And I'm going to make these little Post-it notes. Why don't they have internet or tech access, right? We need to ask the basic questions. Are there current programs or solutions for this problem? And why is it important to solve this problem? Seems like an obvious thing, but I think we should ask that question. And then I would love for us to ideate. Maybe there's different portions of this that needs solving. So like the tech part versus the internet part versus the, I don't even know what might come up. So does this all sound good? Give me a head nod. Give me a thumbs up. Give me a, oh my gosh, I can't wait. Yeah, all right, excellent, all right. So facts, let's look at some facts real quick here. So I pulled these, luckily, like I said, because of the pandemic, we got a lot of recent statistics on telehealth. So here's some statistics. Almost 60% of patients, oh, that's a typo. Let me get rid of that first part. A study of outcomes for 8,000 patients showed there was no difference in care quality between the in-person and telehealth. Huh, interesting. Almost 60% of patients age 65 and older would be willing to manage a chronic condition with telehealth visits, okay? 52% of adults would be willing to conduct a post-surgical visit through video, all right? All Medicaid agencies now cover some form of telehealth application. The majority of consumers are comfortable having their private patient records in the cloud. Audio-only visits have been shown to be useful for patients that could not do video due to tech challenges. And by tech challenges in this study, what they showed was sometimes they did have access to internet and the video, but maybe they were a little bit older, or they just didn't understand how to turn on the video part, and just having the audio was good enough. 48 states require payers to cover telehealth. More than 1/2 of the US hospitals have telehealth programming. 90% of healthcare executives say their organizations are developing or already have a telehealth application. So this is just some background statistics on like where are we starting at, right? Like what's available, where are we? And now here's some challenges. Reimbursement from insurance, even having insurance. This is, we're talking about the US here, where healthcare is a big problem. Obviously, we're talking a lot about that in every context. Seeing your doctor within your state. I actually experienced this issue where I had a doctor's appointment, telehealth in Texas, went to New Hampshire, tried to do my follow-up appointment, and the doctor canceled it. Why? Because that doctor was Texas-based, and you can't virtually see your doctor from another state. I had no idea about that. So that's an interesting thought. You need an email address to create an online account usually for these types of things. 19 million Americans, which is 6% of the population, still lack access to fixed broadband service. This is who we're talking about. This is about students because it was about telelearning, but I think it can totally replicate into healthcare as well. As 4.4 million students still lack consistent access to a computer in the US, and 3.7 million lack internet access. And then 4.4 million households had a computer available, sometimes rarely or never. Woo! This is who we're talking about, y'all. This is why this is really important. The last two things I want to cover, and then I would love for you to unmute yourself and let's start this dialogue. Here's a graph that is showing, oops, let me click, there you go. The blue bars say no computer access. Pink bars are no internet access, and the y-axis is showing the household income. So as we can see, this has a lot to do with income, all right? Also here, we can look at, based on race, their access to computers and internet in the US. So there's also racial disparities here. All right, so I just wanted to get those statistics, get us a little flexed up, our brain juice moving a little bit. And, why don't we start with this question of who are these patients? And that, it might be kind of obvious, but sometimes that's the best way to start brainstorming is who are these patients? And what I would love is for you to unmute, just tell me. Somebody puts it in the chat, you feel free to unmute yourself and read it out loud. And I am going to start to just make these little Post-its.
My 85-year-old mother is one of these patients.
Oh. Is it because she's 85 and doesn't have tech? Or is it because
she has internet access only because when we go there we want to use it, but she has no computer and would not be capable of being able to use one.
Yeah.
Okay.
I guess when you say computer, are you saying phone too?
That's a great point.
Because a lot of things you can do on your phone, do on your phone a lot of things that you can't do, that you don't need a computer.
That's right. That's right. I don't know about those studies above if they included iPads or iPhones. They should. They're mini computers.
Yeah.
Who else?
Rural America.
Rural America. Who else?
I would say that there's language barriers. I work for an organization that delivers psychosocial support, and our Spanish-speaking patients couldn't use Zoom because the instructions are not in Spanish. So we had to use Google Voice instead, which means they can't see each other.
Language barriers. I was going to say Native American reserves. They are historically have been underserved by broadband, wires and stuff. It literally is like they don't have access. So
actually, all utilities, not just broadband.
Yeah, Native American. And I tried to be as open-minded and woke of a white woman as I can. I understand my privilege. If I say something wrong, I am 100% open to unmuting and correcting me. All right, just throwing that out there.
I also saw Adrian said people with disabilities, and just like Nick, my 96-year-old father-in-law has hearing issues, and quite a challenge with my husband and I getting him the access that he needs.
Yes.
Undocumented individuals.
Yes.
People who want to stay hidden.
Yes. Maybe let's do one or two more. Who are these people that we're talking about?
Low literacy, low education, low income.
Lower social economic.
Yeah.
people experiencing homelessness.
Mm.
They don't have access to like most of the things that you would need, right? People.
Right.
Homelessness. All right. So
Somebody said blind community in the chat.
I'm sorry. What?
Someone said blind community.
Blind
Yeah.
community.
Yeah, disabilities, all disabilities.
Yeah. All right. Why don't they have internet or tech access? So some of the reasons are different, right?
Right.
Let's do this color. That looks fun. So why don't some of them have internet or tech access?
Some of it's going to be financial, but some of it's going to be structural. There may be, I think, rural. It's just not.
Yeah, the infrastructure hasn't reached them.
Some it might also be awareness, like they might actually have access through their child's school or something, but they just don't know. And that could combine with the language barrier.
Excellent. Excellent.
And I think some of them are people who may have access to it but don't want to use it as a fear of being discovered, as a way of being found.
Yeah, or have it and then don't have time because they're busy like trying to make money for their family, so they don't have time to use it.
Sure. Working 2 jobs.
Knowledge of how to use it.
Very nice. Good. Yep. I think this is super interesting because it's like financial was only one of these 6 things, you know? And when we try to think about solutions, you know, giving away money maybe not be the only solution, right? Some of it is like awareness campaigns or educational campaigns. So this is really interesting. Are there other ones? We can do more cards if you'd like. Why don't they have internet or tech access?
I think for the people, this is Robin, for the people I work with, which are people here in New York City, and a lot of the people that we work with in our program are older, and they really resist because they truly feel that they want a hands-on visit. They don't want a televisit, even during COVID. And, and they feel short-shrifted. I heard, well, it happened both to me. I'm a very long-term cancer patient, but also 2 of my participants, and we're just an art program, but people talked the other day on in an art workshop about how they thought they were having a televisit with the doctor, but the nurse practitioner was the one who gave the visit, and they thought that the doctor was coming second, and the nurse practitioner said, no, it's me. And both people were really, really offended by that they hadn't told that in advance. And they felt that when they come in for live visits, they always get to see the doctor. So I think here, at least in New York City, there's a lot of resistance. People are very isolated during COVID, and they don't want more isolation. They want more human contact.
Interesting. Would you, I put old ways are comfortable, don't want to convert, and I put mistrust. Am I accurately, you know, posting what you want to get across?
I wouldn't call it just mistrust. I think the idea that they're getting short shrift by a televisit. And even when they have access, that's not what they're used to. It's not what they want.
Not seeing the doctor, though, I think is a common problem, not only for what we're talking about here. I know when I go to the doctor's office, it's always with the nurse practitioner. The doctor is very rarely available. And not that the person isn't capable,
Right.
nurse practitioner,
Right.
they really are.
And when you do, they're very limited time.
I think we all, probably in this cohort, we all feel the same way, which is we know that nurse practitioners can deliver really good services, but it really behooves them to let the patient know in advance what will happen. And perhaps maybe a visit before with a nurse practitioner and then setting up a live visit if possible.
I think we need one more for language barrier there.
Oh, good. Okay.
And And I think when we think of infrastructure, it's not just broadband. You may have an outdated piece of equipment, or
Right.
maybe you only have an iPhone or a cell phone, or not even a sophisticated
A flip phone.
A flip phone, yeah, yeah. Or only it's a phone. It has no visuals.
It's not smart.
I think jitterbug for the older folks.
Mhm.
With that.
I also think some of this comes with just what you've grown up with. So myself, I'm personally a millennial, so I don't mind doing things like telehealth. I think that if you grew up in a world where cell phones weren't part of your daily, usage, or computers, it might just be a little bit, nerve-wracking for somebody to get on one of these things. You hear horror stories of things being hacked, and if you're not used to these things and they're not in your everyday life from when you were a child, it's hard to make that change.
Yeah, like a social or generational rejection, especially since they're so prone to like being hacked and their credit card information stolen and all that.
Well, I think for a lot of older adults, it's the feeling infantilized, really, having someone who's younger than them trying to talk them through it might just feel slightly degrading.
Insecure.
And I think that people thought in March that in April we can just go back to everything the way it was. And now we're looking at long-term changes instead of short-term changes. I know seniors that we work with at Gilda's Club that weren't willing to use telehealth in March have called us within the last month and said, okay, I give up. I'm going to try it, because they realize we may have another year of this.
Yeah.
And even after that, it might not go.
Old ways are comfortable problem could have a solution. Sometimes it might just be time a little bit for that in that case, right? So are there current programs and solutions for this problem? And I went in here actually and added a little bit. The problem we're talking about is lack of tech and internet. So the problem isn't necessarily for us, like telehealth isn't being used by people in general or trusted. I want us to talk about, like, are there programs or solutions to help, the Native American reserves have access to internet? Is there programs for kids living in a household without internet to get internet? Do we know of any of these?
There, at least for I've seen with HISD, and I'm sure other districts are doing this, especially with now children having to do school at home. They were giving out little gadgets that could provide enough internet so that the child could go to school online. And that could be expanded to a larger scale. And also that could be, I was thinking more even outside of the US. I know a lot of communities might not have laptops, but they do have phones now a lot more. So if they were provided that as well, then they could potentially do telehealth over phone.
I know my daughter teaches at Philadelphia Public Schools in high school, and they've been giving out computers to the kids. And Comcast, I think, and maybe Verizon, I'm not sure, has been giving away internet access for them also. So I'm sure that could probably help if their parent or grandparent needed to do something on telemedicine.
Here in New York City, the laptops and tablets that have been given out to students are actually there is internet access, but what you're able to access is very limited. It only goes to the school, so you can't roam the net for other things. And I think I would also, personally, even if it was, I'd have a problem using the same tablet that went to my kid's school for my own personal health, because there's a HIPAA issue. So I think that's a little problematic. I think, there has been an effort here in the public hospital system in New York City to give tablets to patients who don't have access, that are wired directly to the hospital's internet service. I don't know how extensive the program is, though.
Sorry.
My agency is updating our laptops for our staff, and so we're taking the older laptops and issuing them and giving them to our families that need computers.
Many of the senior agencies in big cities have programs for older users on how to access and use the internet. So at least that's available for helping people across the technological barrier. Certainly libraries, when they were open, the problem is they're not open now, provided a lot of access. So that's at the moment a closed door that was available.
A lot of the state and federal, a lot of funders that have received state and federal COVID-19 funding are allowed to use that funding for technology. I know our organization benefited from that in terms of laptops, iPads for client use. So that is available more than I've ever seen it before.
So it's employers providing devices?
No, funding sources, like United Way's community foundations, a lot of the big organizations applied for state and national funding for COVID-19, and technology is one of the areas that they can use it for. So many organizations are applying for iPads and tablets for client use.
And some companies are issuing laptops to staff or giving laptops to staff that need it.
There's also, we received funding for laptops for our staff from our one of our local political representatives too. They have discretionary funding for that type of thing.
Probably goes back to that other question there though too, where it says awareness and don't know what's available, right? That probably crosses over to this.
Yeah, absolutely. So, you know, I'm hearing a lot of like donation of the tech and the donation of maybe free service, you know, monthly subscription, don't worry about it, either from private sector, like Verizon is giving it out, or maybe the government or foundations. Something I'm not hearing about, and that's okay, maybe with I don't know, but what about getting to rural areas? It's not necessarily, you know.
So there's infrastructure that's rolling out that's wireless broadband. So you have obviously you have the 5G that's been very much in the news, but there's also Google using balloons going across geographic areas and providing Wi-Fi that way. And then there's Skynet, which is using satellites. So there's various levels of wireless broadband that's rolling out and it's being tested to see which of these technologies makes the most sense in areas that aren't being covered.
So it sounds like we are still very much early in the innovation of providing rural areas internet, and maybe this wasn't prioritized because there's not as many customers there, and so the technologists and the investors didn't put their brain power and their money into it because there's not, the business model isn't as big. Right?
Exactly, and the wired infrastructure rollout didn't make sense, and so they needed alternatives to running a wire to each house.
We have in Sussex County, we do have one innovative way. Unfortunately, the target audience is very small, but we have a recreational vehicle that travels, that offers that service through one of our nonprofit organizations.
So a mobile hotspot?
It's a mobile, and it has the equipment on it as well.
Nice.
Also, in terms of education, there are senior centers that are providing videos, like actual videos that teach about how to use the internet, while also providing places like establishments where they can go use computers. And now that's moving more to online. And then there are schools that provide computer classes for the parents of the students.
Isn't that interesting? Online courses about how to use the internet. There's some baseline understanding we're going to need to have here. So this is very interesting. So it sounds like private sector is getting involved with donation, government's getting involved with grants, but we need that the startup and investor community to step up. It sounds like, because I'm feeling like a lot of these, none of these solutions are really being brought to us by, you know, we need somebody to care and see that there is still business opportunity, even if it's niche. Niche can still make money, and you need to fund things for things that are niche. This is the forgotten group, the customers. Need to step up. All right. So with this brainstorming, are you like all juiced up now? I'm like, oh my gosh, I'm going to talk about this all day. So we've talked for 30 minutes. For the next 30 minutes, what I want us to do is ideate. So what are some possible solutions? Now, the reason I put different subsets of colors of cards is because I see probably different solutions falling into different categories. Maybe the purples end up being solution, and I'll put a little title card once we start to figure it out. But maybe there's solutions for getting internet to rural areas. Maybe there's solutions for getting, you know, people who are disabled, you know, access to figure, you know, if they're hearing impaired, how do they do telehealth? Or maybe there's financially strapped families. How did we give them internet access? So let's just like throw out a ton of ideas. I'm going to write them on the Post-its, and then we'll start to like categorize them. And then maybe we can pick one or two that we're like, you know what? That's a solution that I think could maybe happen this year or next year, you know? And like, let's see like what would be the next steps of trying to actually take that idea forward and make it a reality. Does that make sense? And does it sound good? This is your workshop. Yeah?
Yeah.
All right, cool. Well, I mean, once we start, it'll like just start flowing, but hit me. What's a potential solution, and get crazy. World,
I think that like no matter what solution or physical solution we pick, there must be a campaign before or during the distribution of that solution, because awareness can take away, first of all, the social rejection, but also with the minorities, how they are not as comfortable using the internet. That'll help so that they can at least go and get the access, or go online to try to get the access.
I'm thinking too high level federal. Say we do have federal rulings in theory about data compatibility, interoperability, meaningful use. What about leaning on the provider system saying you have to, if we're going to give you access to these communities, you have to also provide the infrastructure for communities that have been underserved in the past. I mean, some of this is going to have to be up at the policy level.
Mm-hmm.
Love it. So having the government kind of come down a little bit harder on the AT&Ts of the world, saying, listen, you're making bank for every, 10,000 users you have in a city, you need to provide internet for these 10 people in the middle of Wyoming, something like that.
But also,
Muted herself.
I'm sorry. When we're talking about, medicine, one of the big challenges we all have as consumers, we go to different providers, different places. None of our data is transferable. I can't even take it on a thumb drive and get my records read somewhere else. So this issue of interoperability is a very serious one. Until we have, uniform healthcare, single payer healthcare, we're all in a bind at the moment. And I don't know a way around that, and what level policy or what promotion we could get. Advocacy, I always think that grassroots advocacy makes a big difference. People stand up and say, I need to be able to, understand my medical record and share that information. You've got to make that happen.
I love that. Because one other thing I was thinking of, and Adrian, I do see your comment. I'm going to read it to the group right after this thought, that I was thinking telehealth could really be amazing if we integrated more Fitbit data, or we integrated, there's a lot of fertility tracking apps for women. And so like, how do we integrate that data with your medical visit? So at home blood pressure machines and things like that, things that you would have the nurse do when you first got to your appointment. So making electronic medical records and all data compatible. That's good. And then Adrian, I'm a deaf cancer survivor, also work for an interpreting agency. We've really had to jump through hoops and also ensuring that our service providers have internet access speed and they are not the patient. Oh, one other issue, sorry if it's after the fact, is that the internet access is also very bad within hospitals. Oh my gosh, yeah. Have you ever gone to like a certain floor in a hospital and like the text message doesn't send? Yeah. Especially if they're using wireless connections, so video and audio can be extremely choppy. So one solution would be to go back to the basics of hardwired telehealth centers within healthcare facilities. Adrian, that was such an important point. So I'm gonna,
and that would be very important for rural areas so that people could travel and have telemedicine. Telemedicine can happen outside of the home. It could happen at these community centers throughout rural America, where they just drive into a community health center and then they can have a telemedicine room or telemedicine wing of that that's hardwired, ready to go. And they don't have to rely on the internet that they have at their house.
You know, it's so interesting what Adrian said, thinking about my father-in-law who's profoundly hearing impaired and also an older, very much older adult. You know, you can give him as much, you know, equipment as you want, but it's not going to be helpful because of his disability. And also the knowledge and knowing how to use things. And I think it's something that somebody who's not disabled that I forget about. It's so frustrating for us as a family. There's what I know I'm not offering a solution, but this is a profound problem for people with disabilities. Profound.
Yeah, especially because I have some friends in New Hampshire that are actually interpreters, and I've been asking them so many questions. You need the broadband in order to do a three-way call. You need the patient, you need the doctor, and you need the interpreter, right? And so yeah, totally. Adrian, great point. So I put here prioritizing hardwired internet versus wireless because the video is important. And then also centers with hardwired internet for communities to use rather than focusing on individuals having hotspots maybe, right? Is that, can I get that point? Cool. What are some other ideas? These are good. We are cooking.
So I've got an idea where you have more of a hybrid setup. So, I mean, obviously people loved it when doctors made house calls. So a hybrid situation was the nurse practitioner who's more available makes the house call. They bring a hotspot and they bring a tablet or a computer and they facilitate the telemedicine connection with a doctor. And that doctor can be anywhere, not only in the country, but in the world. And so that gives the reach that people just don't have when they have a geographic limitation to the doctors that they have access to.
I like that.
I do too.
Maybe I love when you flip the problem on its head where you're like, well, why do you even need internet? Let's do at home. And you're like, oh yeah, okay. Oops.
So this is a little off the track of where we are now, but back to the knowledge base. So many people do not have devices, but potentially TVs. You know, what would it look like for publications to periodically be run for education, you know, to help people to walk through the steps, you know, not just for the telehealth, but also for the wellness, communications, and et cetera. Where we are at the Y, we notice that we're supporting a lot of people and giving them, you know, the knowledge of how to even begin to sign on or register. So, you know, the challenge always is how best to get the information to them.
Yeah. So there's one part where it's like, we need to make sure people know that it's available, but then we also have to train them to use it, right? So there's like this awareness piece, but there's also a training how to use it. But
even the basics, yeah.
Oh, I'm sorry, go ahead.
No, I'm sorry. I was saying even the basic steps of, you know, just signing on to or establishing emails to be able to move forward. I mean, I'm thinking even that basic.
Oh yeah, no, totally. And if we're thinking that basic, can we have faith that these people that we've, you know, may have even put it, if we're thinking about COVID times, we've put them at risk because now we're with a trainer, or even if you have PPP on, right, or whatever, but do we have faith that they can go home and still do it? Because I've definitely taught my mother how to do Instagram filters several times, and she's, you know, she still needs me to show her every time, right? And so do we have faith that these folks can go home? And if not, if we're like, well, we can have like a chaperone. Now we're talking about people hearing other people's medical information. So that's interesting too. Even if we think about this like centers with hardwired, we're going to need privacy there.
So we're piloting care coordination for cancer care in Florida. And as Willie was talking, I was thinking the care coordinators could bring their mobile devices and facilitate for the patients and teach them while they're there. It absolutely could be a part of care coordination. There's no reason why they wouldn't be able to do that.
Yeah, we have all that technology ready to go.
We have absolutely, Kim, we have something called a digital Sherpa program where we partner with, I believe it's UCLA here in LA, where they have a group of volunteers who teach our older adults how to use any device they want. So there's video modules that they can look at. They also train them one-on-one. Anybody can sign up to get personalized training. And so it's interesting, as we're talking about all this technology, I think they're also always, it's not divorced from the human touch.
Right.
It's not a discrete entity, technology. It really isn't. I think we'd like to think it is, but it isn't.
Right.
So I think it's funny what Willie was saying and what you were saying, Kim. We're back to how are human beings involved in the delivery of technology.
But going back to what Alma said, a lot of satellite providers have a dedicated channel that runs an infomercial on how to use their equipment. And it just runs constantly. And so, you know, you don't need a computer. You could have a television channel dedicated, you know, by the government that runs these infomercials on how to access sites, how to use your devices. And, you know, it just runs in a continuous loop. So you don't have to schedule it. You just come on, you watch it. And I think that's the accessibility that Alma was talking about there with just a TV.
I love that.
Why does it have to be a video call? I mean, my wife she's a cancer survivor, and she gets a call from her GP every month. It's just a phone call. It's not a video chat.
Man.
They talk to her. They ask her questions.
It's human touch.
Okay. So, I mean, I think a lot more people have phones that don't have computers or internet access. So it doesn't necessarily have to be, I have to see somebody on the phone or, you know, video.
Well, one of the things that we brought up earlier was that people who struggle with hearing impairment, they need to be able to see for the interpreter.
Yes.
But that doesn't mean we can't have multiple solutions.
But aren't there already phone devices, I think, for people like that, that have a screen that interprets the call somehow, I believe?
I don't know. Yeah, I'm not sure about that.
Yeah, I think
you brought up a good point. Maybe if they don't have a phone, maybe they don't have a TV. If we're talking about the experience of someone experiencing homelessness, maybe they do have like an FM radio though, right? And so maybe there's a public channel on the radio that is giving these lessons as well.
Right.
Yeah.
Right. My father-in-law has a caption phone, but he's in rehab. They don't have the caption phones there.
Interesting.
Yeah.
One other thing I was thinking about is what if there was some kind of sometimes I think the public can just step up and do it. And like, what if we had a community internet share where if you knew there was a family in your town that, you know, needed to borrow your internet password for the hour, you know, there was a way to like let them do it. I would let my neighbor borrow it, you know, if they needed it, especially for a healthcare appointment. So maybe some kind of community-based internet share or tech donate program. What do we think about that?
I like that. Also, like, you know, when you fill out your taxes, you can donate to whatever causes. As you pay your bills, you could have a checkbox for, I'm going to donate, you know, $1 or $2 to community shared access.
Yes.
And Comcast already does something where if you have a Comcast, at least here in the Texas market, you can open your router up to other Comcast customers.
Oh.
So just having that, it's a separate network on your home network, but it allows other people to connect to your device if they are a Comcast customer. So maybe some hybrid of that type of model.
Mm-hmm. So you're like a hotspot for the neighborhood or whatever.
Right.
Cool.
So donation of internet may not work in rural areas. All of these solutions like are solving a little piece of all of it.
A mosaic.
Yeah.
But the donation could work in a rural area if it was a coffee shop, or if it was, you know, certain
Community
places
center.
inside community places. Yeah.
Just
An
a
internet
regular
cafe?
community center.
Or they can sit in their car just outside of a community center or something like that and not have to go in.
I wonder if there could be some kind of big national campaign around it. Like I always think about that Cash for Clunkers. I don't even really understand what the heck it was. I was, you know, a little bit younger, but I can remember the tagline, right? And so what if there was some kind of like, you know, get the nation online or some kind of like campaign that people just got behind because they knew it was the right thing to do, you know?
That'd be awesome.
When
Go ahead, Lily.
have I used? And it's like, you have 99% of your internet left this month. I'm like, this is stupid. Sorry, Robin. I think you're.
Hey, I have an issue with asking the private sector to do what I truly believe the government or the companies that already are benefiting from our illness. And to me, I've been sitting and listening to all of these. Every one of us is incredibly altruistic, and we do the work we do because we feel impassioned about it. But the insurance companies, which no matter which candidate gets in, are not going to be dismantled. And yet they are getting the money from all of us or from the government to provide services. And therefore, they should be paying for our devices and for the delivery of services and for the internet. And I'm just wondering, I don't want to talk politics here, but if Biden happens to get in his war on cancer, really, his commission really needs to be made aware of this issue. This is not just about research, it's about the people that already have the illness and need to be served. So we're going to keep insurance companies, and I don't remember who said single payer. I think it was you, Julia. I'm so into single payer, but that doesn't seem like it's very likely in the next administration, no matter who is. And we have to make sure that they do their due diligence for the people that they're making money off of. And I'm firm about that. All our ideas are great. Let's bring it to the insurance companies to do it.
Robin, I love it.
And same with service providers. I mean, the government owns those airwaves. And so we can make them contribute to the solutions that are needed.
Sorry. We haven't been able to make them do anything yet, Willie, but you know, I think it's, whoever said it starts with grassroots, Julia, I think that was you again. We have to get angrier. We're very polite at Livestrong. It's time to get angry, especially during COVID.
We like to call it disruptive.
Okay. I'm older than you. Angry is my word.
Right. Right. The importance of advocacy with all of this here. Yeah.
Yeah. And that's really just being heard, right?
And that's actually what Congress responds to, you know. So when I think back your comment, Robin, about, how do you get advocacy around cancer? Is because survivors stand up and they went down to Congress and they said, this is not okay. And basically put pressure on their representatives and their senatorial members and said, you need to pass laws that are going to change this situation. So I never underestimate the power of advocacy, ever.
I love it. All right, it's 11.
Dr. Barreto, this is your 10-minute from Livestrong, and a couple thoughts over here from HQ. What about in-home healthcare providers or hospice services being integrated to provide that hotspot? Or, and then also love the idea of, similar to how the government has to do a certain amount of low-income housing, being required to have the internet providers do a certain amount of low-income accessibility. And also thinking about stores that are often in rural communities and how could they extend their internet to, the Dollar Trees or Walmarts of the world. How could they make their connections available to people in rural communities?
Have Walmart step up.
They'd be glad to, because that's foot traffic for them, right?
Yeah.
Or Target. I mean, I'm trying to think of the big, one-stop shop.
Dollar General.
I'll put Walmart in quotations. You know what I mean?
Yeah.
Well, then, kind of feeding off of that idea, if the internet was free and accessible in those stores or places that were just mentioned, could we have private rooms that people could go into and talk, kind of like the nursing mothers' rooms, but something for use of this sort?
Yeah.
Kind of like a phone booth.
What's that?
Sorry, I'm showing my age here.
I'm just playing.
Oh, we needed a use for those old boxes. What a great idea, Willie.
All right, so I'm going to, I'm just gonna delete some of these empty cards. Oops, come on. And then let's kind of look at what we have here. We have a bunch of education, so awareness campaign and training. I feel like the TV training and the radio training, those kind of all go under this one. And then awareness, we have laws, so let's delete that one. Telling the service providers must provide, internet providers, yep, that's the same. Insurance, tell Congress, tell Biden. Adrian says, internet also needs to be reclassified as utility. What about MiFi access? Could local governments have portable devices that come already connected that could be tied into a hybrid solution with home visit nurse or digital Sherpa? Adrian, you're awesome. That's, where do people think that I should, is that a new card or is that an additional added to a card we already have here?
It's kind of between laws and tech access.
Yeah. And I have a feeling we're gonna make a hybrid. Like this solution is gonna be a hybrid of several of these, right? So let's see. So tech access, let me zoom in on my own thing. Make electronic medical records compatible, prioritize hard wiring, the centers, that's a center, community donation. So I would say, let's put community donation over here. And then the centers, Walmart could be a center. This is a center. Medical records, prioritize hard wiring. I see all these kind of being kind of similar. Digital Sherpas, volunteers to train. I think that goes in education. Making and then compatibility. So how many people were moved that the idea that we should move forward with is one of pushing for government change rather than us just doing it on our own and via community? Oh yeah, Robin's like
I think it has to be a combination too.
Great.
You know, I have to say something. I really see this as a systemic issue. This is, you know, we're talking about all day about these solutions with the same population of people who have been left out in every sector of our lives. So solving it for healthcare, you know, we need to solve it for education. We need to solve it for business. And we can't do that. And I think my organization's been a Livestrong grantee over the years, and we've done amazing work. But it's still up to the private sector to raise the funds to do that. And I think I'm 65 now. I'm angry and I'm tired of it. And I think this is a pivotal moment for all of us. I think, you know, I'm calling all of you to action in a much stronger way. Not that we shouldn't do this also, because we have to do something in the short run, but otherwise our lives are going to be the same. The people at the bottom are going to stay at the bottom. You can't do more for people unless you get less for yourself. And that's just the way the government has not been operating. So that's my socialist speech for the day. Sorry.
I love it, Robin. What I'm hearing is a short term and a long term. There's a short term, people are dying, kids need education. They can't wait for the government to figure it out in 10 years. They are currently in 2nd grade. They need internet access, right? So like there's this community part, and then there's this long term, like we're gonna fight the fight, we're gonna go to Washington, we're gonna vote, terms are gonna come and pass, right?
Yeah, right. Yes.
So,
I think those of us who, oh, sorry.
No, go ahead.
I think those of us who've been doing this work for a long time in the cancer sector, you know, I've been a survivor for 28 years in and out of treatment, and the problems are the same. Nothing has changed. And yet we are all as fierce as we ever were. And we were fierce back then and we're fierce now. And I would love to see Livestrong become a lobbying group for the government and meet directly with Joe Biden or whoever. And, you know, be a major player in this. We have the solutions. They have to help us do it.
What do we think about me making a Post-it note that says Livestrong becoming active, politically active? Is that a card we're down with? I see
it takes another type of organization instead of a 3C. A political organization is a different, and believe me, we've gone down that discussion many times. Should we launch one of those? And so that's always a question that's looming in the future. You know, do we branch out and make a political arm?
Well, or there's the concept of partnering with a different organization to do that. Cancer Support Community has a very strong advocacy arm and very similar missions and philosophies between the two
we would
organizations.
prefer not to reinvent the wheel.
Yes, absolutely.
Yeah.
We already do it with OVAC, don't we, somewhat?
We do. Yep.
Yeah, because I've gone in there 4 times myself and talked to senators and congressmen about funding for cancer research. So,
and we did it with CPRIT. Which here in Texas was quite an accomplishment.
Right.
So what I'm hearing is that, whoopsies, I don't want an arrow. Just ignore this arrow. I don't know what the heck. Number 1 is maybe, you know, we bring it up to Livestrong, like, hey, this problem, it's not just a grassroots solution anymore. We want to be up in the law, you know, changing the way private sector works, the insurance payers, right? And so the short-term goal is like further conversations or pushing Livestrong to get more involved with policy change. And then also another short-term is potentially a community donation program of tech and internet. And then the long term sounds like our long-term goal is policy change. Policy change that provides tech training on the radio and the TV so people can access internet, you know, how to use the internet, how to use technology, and let's see, what else? Awareness campaigns on the radio and the internet as well, right? Hey, telehealth is a thing. You can still see your doctor. Like, you know, here's how that works. And then we want insurance, service providers and insurance to be stepping up and funding these things is what I'm hearing. So we're at the end of our hour here. Wow, y'all are amazing. You are like, seriously, this is awesome. What I would love to do is anybody who wants to, we should probably exchange some kind of information potentially, like email or how to contact, because something that Livestrong would love to do is see these things come to life, right? And so I don't know if my Livestrong affiliate is still on the line, but I don't know how we all get in touch with each other, if we put emails in the chat or what.
You're welcome to exchange directly, and we will also be distributing a participant list post summit as well with contact information.
Will you divide that up on who attended what?
We can certainly make that request, yes.
That would be great, right? Everyone agree with that? If we knew, if we could see a contact list of who attended this, then we'll know.
Yeah.
Yes.
Great. Because when I get that list, I will share this mural board with y'all, so you can have it too. Yeah. This has been amazing. Thank you all so much for your time today. Everything you do at Livestrong, everything you do just as an individual in the world. The world is tough. And I am so grateful you spent your Friday morning, if it's morning for you, here with me. Thank you all so much, and I'll see you in another workshop.
Thank you.
Thanks, everybody.
Bye.
Thank you.
Thank you.
Bye, everyone.